Moulton, and I'm a junior integrated science major at TLU, currently enrolled in the Kinesiology 275 Medical Terminology course. Today I'll be discussing a fascinating and complex topic, the autonomic nervous system, or ANS. Specifically, we'll look at the two major divisions of the ANS, the sympathetic nervous system and the parasympathetic nervous system, and explore how these systems control the involuntary actions of our body. I will also explain how this knowledge is directly related to understanding postural orthostatic tachycardia syndrome, commonly known as POTS, a condition that many clinicians encounter in practice. Let's dive right in. So what is the autonomic nervous system? The autonomic nervous system, or ANS, is our body's command center for regulating functions that we do not consciously control. This includes everything from our heart rate and digestion to respiratory and glandular functions. The term autonomic comes from the Latin roots auto, meaning self, nom, meaning law, and ik, meaning pertaining to. Literally, it translates to pertaining to self-rule, emphasizing how this system operates independently to maintain vital functions without conscious effort. Today's presentation will focus on breaking down the integral roles of both the sympathetic nervous system, or SNS, and the parasympathetic nervous system, or PSNS. I will also touch on important terms and concepts as we see how these principles apply to real-world health conditions like postural orthostatic tachycardia syndrome, or POTS. In doing so, you'll see why understanding the ANS is essential from not only a physiological standpoint, but also for effective healthcare delivery. Let's begin by understanding the basic anatomy of the ANS. It's comprised of a network that connects our central nervous system, namely the brain and spinal cord, to our organs through peripheral nerves. A key component of this network is the ganglia, or clusters of nerve cell bodies, which act as relay stations helping distribute nerve impulses efficiently across the body. These structures ensure that information from the brain is transmitted effectively, allowing the ANS to modulate involuntary functions with precision. This anatomical arrangement is central to how our body maintains balance and responds to internal and external changes. Let's dive into some key elements that enable the ANS to function effectively. First, consider the neurotransmitters acetylcholine, or ACH, which primarily supports the parasympathetic responses, and norepinephrine, the messenger that drives the sympathetic reactions. These chemical messengers are essential for maintaining autonomic balance, but when their signaling is disrupted, it can lead to disorders that interfere with involuntary bodily functions. One such disorder is dysautonomia. Dysautonomia comes from the Latin roots dis, meaning bad, auto, meaning self, and nom, meaning law, with the suffix ia, meaning condition. So it literally translates to a condition of bad self-rule, which perfectly captures the disruption of the autonomic regulation in disorders like POTS. This malfunction can interfere with critical involuntary actions that keep the body stable and functioning efficiently. Along the same lines, baroreceptors are specialized sensors that monitor blood pressure changes, ensuring that our cardiovascular system adjusts appropriately to maintain stability. Now let's compare the two major branches of the ANS, the SNS and the PSNS. The sympathetic nervous system is often characterized as the fight-or-flight system. When activated, it increases heart rate, dilates your airways, and it mobilizes energy reserves. All responses necessary in stressful or emergency situations. I like to think of this system as sympathetic to your immediate survival. On the other hand, the parasympathetic nervous system is known as the rest and digest system. It is responsible for conserving energy, promoting digestion, and restoring the body's peace after stress. Although these two systems work in opposition to some degree, they also collaborate to maintain a state of balance or homeostasis within the body. This duality is essential for our survival and well-being. Postural orthostatic tachycardia syndrome, or POTS, is an excellent example of how dysregulation in the ANS can affect overall health. In POTS, the body exhibits an abnormal increase in heart rate when moving from a seated or supine position to standing. This results in symptoms such as dizziness, lightheadedness, and profound fatigue. Another hallmark feature of POTS is hypotension, or low blood pressure upon standing. The term hypotension comes from the Latin roots hypo, meaning under, tense, meaning pressure, and eon, meaning process. It literally translates to process under pressure, which directly reflects the body's struggle to maintain adequate blood flow when changing positions. This drop in blood pressure contributes to many of the symptoms associated with POTS, making it a key factor in understanding the condition's physiological impact. Essentially, when the balance between the SNS and PSNS is disturbed, often due to dysautonomia, the body struggles to maintain stable blood pressure and heart rate. This connection underscores the importance of a deep understanding of the ANS in diagnosing and clinically managing such conditions. From a clinical perspective, the diagnosis and management of conditions like POTS require careful assessment of autonomic function. One of the most widely used diagnostic tools is the tilt table test. This test involves monitoring a patient's heart rate and blood pressure as they move from a lying down to a standing position, thereby revealing abnormalities in autonomic control. Additional diagnostic methods include evaluating heart rate variability and imaging techniques to further assess ANS function. Understanding the roles of key neurotransmitters and the function of baroreceptors can improve targeted treatment strategies and patient outcomes. In conclusion, the autonomic nervous system is a master regulator of our involuntary bodily functions, governed by the precise balance between the sympathetic and parasympathetic systems. Through the coordinated release of neurotransmitters like ACH and norepinephrine, and through the intricate work of structures such as ganglia and baroreceptors, the ANS keeps our internal environment stable and responsive to change. Conditions like POTS clearly illustrate the clinical significance of any disruption in this balance, as these dysautonomias can greatly affect quality of life. As future healthcare professionals, deepening our understanding of these systems not only broadens our knowledge, but also enhances our capability to provide precise, compassionate care. Thank you for your attention today. I appreciate the opportunity to share this overview of the ANS and its crucial role in both healthy functioning and clinical conditions such as POTS. While I won't be able to take any questions, I would like to encourage you to further your research on your own. As a pre-medical student dedicated to advancing the understanding of human physiology and its applications in healthcare, I look forward to contributing to ongoing research in this field. As I wrap up, I would like to remind you that every question is a spark, and let them ignite your own research and further your educational journey. Thank you again for learning with me, and goodbye. All images used were obtained from open sources or created using Canva's AI image generator. Before you is a list of my references if you would like to dig deeper into the research that I have found. Thank you.